Welcome to the show. Today we'll be talking about a topic that affects all of us, and that is sleep. Joining us today is Dr. Eric Sklar. Dr. Sklar is a neurologist who is board certified in neurology, sleep medicine, clinical neurophysiology, and vascular neurology with more than 17 years of experience. I've known Dr. Sklar for years myself, and I can definitely attest that he knows what he's talking about in these areas. He treats patients with a wide variety of disorders, including sleep apnea, restless leg syndrome, narcolepsy, and serves as the medical director of the Inova Sleep Disorders Program.
Welcome, Dr. Sklar. We're so happy to have you today. Let's just start at the basics. Why is sleep so important? I think we all read a lot. We know it's important, but it's also sometimes the first thing that we give up if things are stressful or busy or, sometimes by choice and sometimes not. But talk to us about, why it's so important and how we can make sure that we can get to sleep and stay asleep.
Well, like Sam said at the very beginning, it affects all of us, right? Everyone needs to sleep. So that just tells you the importance right there. Um, Sleep has a lot of important functions in terms of physical rejuvenation, cognitive restoration. The brain gets rid of waste products during sleep, and the body has a chance to recover. And it's intimately tied into a lot of cognitive and physical things. And so, if to maintain optimized cognitive and physical activity, sleep is an important part of that. Why we treat a lot of people who have problems because they want to get back to feeling better.
And I know I am always amused by, or maybe just fascinated by the people that are like, I only need 4 hours of sleep a night. Is that really true for some people? Like, I know it's not true for me. I'm more of an 8 hour kind of girl, but anywhere between 6 and 8 feels like more the norm. But some people I know say like, oh no, I can be at my best with 4 hours.
Right. I mean, there's a wide range. I mean, the typical adult will require somewhere between 7 to 9 hours of sleep for real optimal sleep. Obviously, people get by on less. As far as people who actually need less or require less, I think there is a small subset of people who don't need as much sleep as others, and they would be able to function without like loading up on caffeine or taking a nap or things like that. But most healthy adults need between 7 and 9 hours of sleep.
Okay, so the person who says, "Oh, I only need 4 hours of sleep," and actually plays out that they're very functional on those 4 hours of sleep. Even for those people, is there any long-term detrimental effect to that? Or is how functional you are with X numbers of sleep a good marker of the effect it's having on your body? You know what I mean? Like,
Sure,
if I get
sure.
by on a few hours of sleep, does that also mean it's not harming me?
Right, I wouldn't go that far. Because lots of people function on less sleep than they should be getting. And in society, we have a lot of ways to compensate for that, right? Caffeine being one of them. So I wouldn't correlate daily functioning with like, hey, lack of sleep is not going to cause you any problems. I guess it depends, and this is what we do in our clinic. You have to kind of do a deep dive as to why they're getting so little sleep. Um, what's happening when they are sleeping? Do they wake up a lot? And how do they feel? How do they feel in the morning? How do they feel during the day? Do they need to take a nap or like really wish they could take a nap or nap on the weekends when things are quiet? Those kinds of things usually fill in the blanks in terms of, okay, well, you're probably more tired than you really realized.
Yeah.
I mean, it's great that people can function, but
Yeah,
that
but there
doesn't
could
really
be.
take away the detrimental effects of lack of sleep.
Well, let me ask you, so what is the most common complaint you get as it relates to sleep?
I would say the most common thing that we see is like for a sleep apnea evaluation. It's
Mm.
kind of been in the news. It's more there's more awareness behind it, so we get a lot of people for that. As in terms of complaints, it's one of two things, and this is kind of the end result of any sleep disorder. It's either insomnia, like not being able to sleep well, waking up a lot, or being tired during the day, excessive daytime sleepiness. Um, and usually from there, we'll find out what the causes are. Sleep apnea being the most common, or
And
certainly
are
one of
most of
the
these
most common.
referrals like somebody sent someone over, or does someone show up and say, "Hey, I was watching the news and I thought I might have sleep apnea," or "My girlfriend is telling me I'm snoring a lot.
Right.
Like what happened to me?" and they ask you to come see you.
Yeah, most of the referrals are from either primary doctors, or we see people from the bariatrics clinic, or the cardiology clinic is pretty common. Um, but invariably, when someone comes in and I start talking, and if they're talking about snoring or they're breathing at night, they'll say their spouse was concerned. Also, they talked about it with their primary doctor. So it's a little bit of everything.
That's great. And so talk about how, what are like when somebody's seeing you, what are the treatments?
Yeah, so obviously, we do a deep dive into what their sleep pattern is, what
Mhm.
they're doing, what's happening, and depending on what those answers are, will kind of guide what we're talking about. So, for example, one of the more common things we see is people have bad sleep hygiene, right?
Mm.
So, they're watching TV late at night. They're on their phone in bed, scrolling for a while before they turn it off and try to go to sleep. And those types of electronics and screens are very activating to the brain.
Mhm.
And so if they have a problem with sleep hygiene, then that's the first step. Hey, turn those off. Now, easier said than done. It's a process, but usually we'll recommend that they not use any of that stuff in bed, because that creates a subconscious connection to kind of being cognitively activated while you're in bed. So that's counterproductive to good sleep. And then we'll suggest that they also kind of give themselves a buffer time between turning off the screens and going to bed. Usually between 30 and 60 minutes. I would say longer is better. Just allow their brain to kind of power down and kind of relax. And it can be hard because scrolling on your phone while you're just vegging in bed seems kind
Relaxing
of
for some.
relaxing. Right, right. But the screens are um, very activating to the brain, and a lot of people will say, "Well, I have the blue light filter
I was gonna
on,"
ask about
and
that.
so
Oh,
forth.
the Kindle
Um,
or whatever product,
yeah,
yeah.
and there's obviously a spectrum of, like, worse and better, so, using the filter is probably better than not using the filter, but,
Mhm.
there have been studies that show that the retina is just as activated even
Mm.
with the filters, and so I will recommend, especially if I'm seeing someone who has a sleep problem,
Right.
like, you know what? You just gotta turn it off.
Yeah.
Right.
And this is
Go to the
something.
library, get a real book.
Well, I was gonna say, so it sounds from what you're saying that it's not just that your brain is being jogged or cognitively stimulated, because reading a book could do the same. So is it specifically the screen that you're talking about? The
Yeah,
idea of the screen,
yeah.
right? Not the fact that I'm reading something.
Well, I mean, again, there's a
Or is that
spectrum.
also a spectrum
Yeah,
that
there's a spectrum of what's, like, the worst thing you can do, which is probably, like, a 70-inch TV in your bedroom, and, like, probably the least worst thing you could do, which would be reading a book in bed.
yeah,
It's still generally recommended not to read in
not to do that.
bed, but sure, I mean, reading a paper book is gonna be less of an issue than, like, reading a book on a bright, iPad.
So what are the things you should be doing to sort of wind down? Is it you're like, well, maybe take a shower or do some yoga or just lay in bed or write?
I mean, a lot of people do, they just delay and delay and delay. But,
Right.
to your question, what I try and do is I tell people, well, you want to do things that are not like very stimulating. Now, they can listen to things. So I mean, a swap out would be an audio book or an audio
Hmm.
podcast or listening to some soft music. Now, I do have to kind of specify, hey, don't have a page turner audiobook that you just can't wait to hear the next chapter. You want something more mundane that's not going to have you on the edge of your seat. Then I also tell people, as a little bit of a switch up, I think a lot of people will kind of do their chores, empty the dishwasher, fold the laundry, and then like reward themselves by watching TV. So I would say, well, maybe save your laundry for last. Fold your laundry last. That's kind of a
Going to
mundane
definitely more appealing.
yeah. And then, maybe that gets them to sleep. So, but so I tell people to do things like that. Yeah, shower,
Yeah.
bath certainly is a relaxing thing. So, things like that. I mean, you have to be creative. I mean, the world we live in is kind of, screens are a big part of
Big
it.
part of
So,
it. Yeah.
yeah, for someone that has a real problem, I mean, that's the first place to start.
So what about talk about the impact? I feel like I've read a lot about this.
Mhm.
How does drinking alcohol and sleep correlate?
Yeah. Well, I think there's a lot about alcohol in the news now,
Right.
just about like they want to classify it as a carcinogen and so
Mm.
forth. Um, as far as sleep goes, it's one of these paradoxical things because it is relaxing and it is a sedative, but it is also disruptive to sleep
Mm.
architecture. And so while alcohol will, and probably most people can attest to this, while alcohol will help put you to sleep, you're not going to have a real great sleep.
Mm.
And so that's just another reason to not drink alcohol. And certainly, we don't want to push that people to drink alcohol to kind of help them get to sleep.
No.
Um, from a medical standpoint, alcohol and sedatives like that actually worsen sleep apnea.
Mm.
So if there is an underlying sleep condition like sleep apnea, alcohol can exacerbate it or make it worse. So, so I tell people, I mean, if they're having a glass of wine at dinner, at 6:30 and they go to bed at 10, I mean, that's probably not going to have a real effect. But if they're like drinking 2 or 3 beers, into the evening while they're watching a game on TV, I mean, that could have more of an effect.
If you take all the patients who come in, with some sort of insomnia type complaint, and you put aside the sleep apnea category, are the majority of the patients you see um, who have a sleep problem really it comes down to sleep hygiene? Is that the most common cause?
I wouldn't say that. I mean, insomnia is certainly like one of the most common sleep things out there in the world. Um, so I wouldn't say that sleep hygiene is always like the cause. It's like anything. There's usually a bunch of factors, and that's one of them. And I'll tell people, I'll say, listen, this isn't probably going to solve everything, but it's not going to hurt. Um, so yeah, I mean, there's a lot of different things that play into insomnia. So, mental health plays a big role in insomnia. There's a very high correlation with things like anxiety, depression, PTSD. Um, and so we'll get people who are not really controlled in terms of anxiety or depression, and they can't sleep. Talk to your psychiatrist, your primary doctor, but you got to treat your anxiety better. You got to get that under control because if you lie down and your thoughts start racing and you can't shut down kind of ruminating thoughts and so forth, that's going to affect your sleep. And, it's not really a sleep disorder. It's a mental health disorder that has a symptom of a sleep
Yeah.
problem.
And
And
does it
that's a big thing.
exacerbate the mental health disorder? So does it also have a secondary effect? So I don't sleep now. I'm more anxious.
Yeah, yeah.
Circular.
I mean, it's a real chicken or egg kind of thing because, you don't sleep well because of anxiety, depression, and then you're tired, and then you're kind of like more depressed and you have lower energy. And then, a lot of people can develop what's called psychophysiologic insomnia, where they start worrying about
About
the
that.
They
next night
yeah.
Yeah.
because, like, okay, I'm not sleeping well, and they get a little anxious about
What's can't sleep.
what's tonight gonna be like? Tonight can be another one of those nights?
Are there things people can do if they are finding that they're waking up in the middle of the night? What do you usually tell those patients?
Yeah, I mean, so it's definitely not recommended to just, like, lie in bed for hours on end,
Yeah.
um, because, again, you create a subconscious connection, being in bed and not being asleep.
Mhm.
You want to have the connection that when you're in bed, you're sleeping. Um, so if someone wakes up during the night and can't get back to sleep, again, you want to make sure are there any mental health issues because a lot of times why can't they get back to sleep?
Right.
Well, then the thoughts kick in. Then the anxiety comes up. So again, then you go back to treating that part of it. But if someone cannot get back to sleep and I say don't look at the clock, but if you feel like 15, 20 minutes to go by, maybe 30, then, you can get out of bed, go into a different room, keep the lights low. You could read a book, a magazine, don't turn on your phone, don't
Right.
watch TV, don't go eat anything. But, try to keep, to do something very mundane, like we talked about before. And then if you start to get tired again, then go right back into bed. And that's kind of the strategy for some of that stuff.
So I know we've kind of danced a little bit around and mentioned sleep apnea, but tell us what the symptoms are.
So snoring is a big one.
Mhm.
Not all snoring is sleep apnea, but snoring can be a big sign. And so it'll usually be someone coming in prodded by their family or spouse to get checked out because they're snoring very loudly, maybe disrupting other family members. And and so
I'm getting half my diagnoses from these podcasts, by the way.
yeah. And so, you can get someone that'll come in and be like, "Yeah, I'm sleeping in the guest room now, so I thought it was time to get checked out." And so that's one way. And then another thing that people complain about is being tired, right?
Mhm.
They're maybe sleeping 7, 8 hours, but they feel like they slept 3, and they're kind of tired all day, and they're loading up on caffeine. And, you might have some people at night, a spouse or a family member, say that they actually feel like the patient stops breathing. That's a big red flag.
Yeah.
Um,
Yeah.
sometimes patients themselves will wake, yeah, I'm waking
Like a
up, gasp, wake
fast
the answer.
Yeah.
Yeah. So those are the big ones for sleep apnea. And then we do see a lot of people. I mean, sleep apnea is pretty tightly linked with a lot of cardiovascular, cerebrovascular disease. So there's a higher risk of stroke and heart attacks and AFib and things like that. So,
Pressure,
for what?
high blood pressure too, right?
Yeah, high
I
blood
mean,
pressure.
some
Yeah,
people's blood pressure improves just by
right.
treating their sleep apnea.
And we use, in terms of like a screening tool, we use something called a stop bang, which is basically 8 risk factors for sleep apnea. And it's been shown that if you score 3 or more, that correlates with a higher risk of sleep apnea. So that would be that you snore would be one, snore loudly. Um, Stop breathing at night. So someone says maybe you stop breathing. Um, uh, if you have high blood pressure is another one. Are you tired during the day is another one. If you're over 50 years old, if you're a male, if you have a large neck size, so
Mhm.
over 17 inches in women, over 16 inches, um, and and if your BMI is above 35. Although I would probably argue that a BMI even over 30 is a higher risk. Of the people that I see, and most of these people do have a sleep study ordered because that's what they're there for, and that's what they
Right.
need to find out. Um, I would say it is pretty rare to see like a totally negative sleep study.
Interesting.
Uh,
In the snorers.
in the snores,
Yeah.
yeah, yeah. Now, they might not have full-blown sleep apnea, but, there's also a spectrum of sleep disturbed breathing, right?
Yeah.
So, they could have what's called upper airway resistance syndrome, which is disruptive, but it's not really mean criteria for sleep apnea. They could have mild, moderate, or severe sleep apnea. They could just have primary snoring.
Yeah.
Um, but I would say of the people we're seeing in clinic for sure that kind of self select,
Yeah.
for snoring, very high percentage, have some degree of sleep disturbed breathing.
Is there a role or what is the role for medication? And and I'm even more simply than prescription medication,
Mhm.
just the go-to, right? The average person who's having issues with sleep, I'm sure, has at one point taken a Benadryl or a Tylenol
Sure.
PM or something over the counter. Is there a role for that? What is the role for that? Do you generally caution against it separate from the long-term
Yeah.
strategy type stuff you're
So if we're
talking
just
about?
treating insomnia without some other comorbid sleep disorder,
Yeah.
so it depends on the situation, obviously, whether it's kind of an acute insomnia or more chronic. But the main treatment for certainly chronic insomnia is actually not medicine. It's behavioral therapy, CBTI or cognitive behavioral
Mm,
therapy for insomnia. That's really first line research proven treatment for chronic insomnia. Now, in more acute cases where, someone had a death in the family and they're really distraught and they need something to sleep, we do use, like sedative hypnotics, on a short-term basis. And then, for people that need something on a more chronic basis, we always push for CBTI because that's really important. And some people are more into it than others.
yeah.
But there are some medications that are used for chronic insomnia that are like not controlled like some of the more acute medications. And so we'll use those in conjunction with the behavioral therapy.
But the acute being, yeah, just to restate what you already said, but the idea there is, listen, you have some specific thing going on or whatever it is, physiologic, mental, etc., and you're just getting through this zone. that's more of the powerful or more relevant
Yeah, we'll use
type of let's
medications.
use medications to get you through this, but it is a longstanding problem we
Right.
try to avoid.
And we wanna get to the underlying
Yeah.
issues, right? And so people who have had insomnia in the past are more prone to bouts of acute insomnia. So again, is that an anxiety issue that probably needs to be controlled? Is it just a predisposition to kind of acute stressors causing insomnia? It depends on the situation.
Yeah.
If it's a real anxiety component, then we might use a benzo. Again, very short duration. We have the sedative hypnotics. There's some other medications. Even over the counter medications are in a very short term basis probably okay. We don't like to have people use like Benadryl long term.
Yeah.
Those antihistamines can have cognitive side effects if used long terms.
How long is the average sleep study? Is it like you come in because for our listeners, I'm sure they're curious. Um, is this like a come in and you spend a full night? Is it, hey, we just need to watch you for 4 hours? What is it, 1 hour? What does it look like?
Well, I mean, think about how long you'd want to sleep. You'd want to sleep a whole night. So it is a whole night thing. There's a couple of different types of sleep studies we use. So it depends on the situation, other medical problems, if there's been past testing, things like that. But an overnight piezomogram, which is when someone would come in the lab and kind of get, quote, hooked up. They would come in, in the evening, and they'd be given instructions by the technician, and then they have the electrodes put on them, and then it's usually lights out, 10:30, 11, and then they go until about 6:30 when either they're up or they get woken up, and then they get disconnected. And so we usually have, 7, 8 hours of data to review.
And do
Um,
people tend to sleep pretty well? I mean, are you giving them like nice, cozy conditions in these sleep baths for them to,
yeah, we get
or are
that
they,
question a lot. Yeah.
It's to feel like a social style.
Yeah. I wouldn't say a luxury hotel, but we have rooms that are done up like a little small studio.
yeah.
There's like a real bed, night table, yeah, it's set up like a little mini bedroom. It's not like you're on a hard exam table.
Right, right.
And in some cases, you can send the study home with people, right? They can do it in their own home.
Yeah, so another option, again, usually for very medically uncomplicated patients, but a home sleep study where patients will wear a device. The one that we use is called WatchPad, and it goes on the arm. There are a lot of other traditional ones that you strap something around your chest and so forth.
Mm.
But basically, yeah, the patient would go home with like a kit, and they would put that on, and that can be helpful for some people that maybe have like more irregular hours, right? Like if they're working a late shift and they don't go to bed until 2 a.m. Well, I mean, having them come in the lab and try to go to bed 4 hours earlier than that can sometimes be a problem. So the home tests are they're good screening tests for sleep apnea.
What are your thoughts on um this upcoming all the recent trend in wearables? So it's sort of a two-part question. One, just the wearables in general, like the
Yeah.
Oura Ring on sleep, and then two, the Apple Watch claim
Right.
on sleep apnea.
Right.
What are your thoughts on either of those things?
Yeah, I mean, so as far as sleep apnea goes, I think it's all about screening, right? So they're not medical grade, obviously, but I mean, if the Apple Watch is showing that you have dips in your oxygen and you know that you snore, I don't know what the algorithm is for it to say, "Hey, get checked out," but that could definitely prompt people to get checked out. Things like the Oura Ring or other trackers, I always tell patients to kinda take it with a grain of salt. Certainly some patients will come in with, like, a list of, or a printout.
Where's the data?
You're right, printout of, like, their night's sleep, and I think in general, with what the data that these trackers collect, it kinda correlates with what they already know, right? "Hey, I'm not sleeping well, and this is showing me that I'm waking up 10 times a night,"
Right.
and so I think it can be helpful for trends, but it can
Not so
be
much cause, like it's telling you,
yeah,
hey, you did have a good night's sleep. Oh,
it's
great. I
'cause
better do
it's
this.
maybe that it's correlate with what you know that, hey, you're not sleeping great, and, it's not gonna tell you why. And it can be counterproductive. I mean, in certain patients with the right personality, they can get a little too fixated on, like, the
Mm,
number, what was my sleep quality? "Oh, I got a 75 tonight,"
yeah.
Right.
they can get a little too fixated on that stuff. Again, good data points to have, but probably telling you what you already
Yeah.
know. Um, But yeah, the new Apple Watch app, I think I think it just says, "Hey, you may be at risk," and
Yeah,
I don't
it
even
could
know
be
what
like you
it
said, a
says.
screening, like a
Right.
prompter for you to say, okay, I should look into
I
this
should call my
further.
doctor.
Yeah.
Anything you'd like to leave us with? We're really grateful and appreciative of all this great information you shared with us today.
Yeah, I mean, the thing I tell patients all the time is, they only know their own experience, and I see a lot of patients that put off getting evaluated for a long time because they think, "Oh, everyone with kids is tired. Everyone who works a job is tired." And I mean, there might be some truth to that, but it doesn't mean that you might not have something else. So a lot of people put this off because they think they just feel the way they should feel, and in reality, they might have something that could be treated and not only be treated and make them feel better, but also have a more positive impact on their general health.
Right.
Thank
Glad to
you.
be
That's
here.
great advice. Agree with Tracy.
Thank you so much.
Thanks
Really
again.
appreciate the time today.
Yeah, no problem. Glad to be here.